To this session as we take a look at basic searching for CINAHL on the new EBSCOhost interface. As I'm sure most of you or a number of you will know, you recently transitioned to the new platform for EBSCOhost a couple of weeks ago, in fact. So it's been available for some time, but the most recent and the final migrations transition to it took place in mid-July. So we're now a few weeks on from there. So we'll introduce you to this. I hasten to add it is a basic session, so I won't cover all the features functionality that you're looking forward to seeing perhaps today. I will cover that in the advanced session, which starts, the first of which is next week. So this is the first of two basic sessions, and then we have two advanced sessions coming up as well. So you may have registered for the advanced session also. If not, please do so when you can. So to formally introduce myself, I'm Richard Crooks. I work for the EBSCO Customer Training Service team as a senior customer training specialist. Been with EBSCO now for more than 14 years. I typically support library services end users in the UK, Ireland, and also the Nordics as well. So not just NHS library services as well. So moving on here then, in terms of what we plan to cover for this session. So we'll introduce the AI assisted search. We'll look at that. Focus mainly on keyword searching, although I will include subject searching as well. And also looking at how you refine your search results, filtering results, viewing results, and also the MyEBSCO account for storing, retrieving article searches, etc. So in relation to the agenda then, the actual objectives for this session are these. So I hope that by the end of this session, so within the hour, you'll be able to use AI-assisted search to retrieve relevant results. So you may have already been using this. You'll be able to form keyword searches to find full text articles. That will also be combined with the use of the subheadings, which I'll mention as we go through the initial presentation. You'll be able to use available filters to refine search results, and of course, display, view, and access full text records. So look at those, and also use a MyEBSCO account, a personal account, to store and retrieve results and searches. So again, this is what I'm going to focus on. So the searching itself will be more or less at a basic level, and there'll be more to come in the advanced session. So before I go any further, just for those who may be new to CINAHL or not so familiar with it, or just as a recap, then just to remind you that you've got access nationally to the CINAHL database. This is the basic abstract and index only database. So there's a small subset of active full text journals, but mainly you'll find content where there are abstracts. You may find there are other links to other publisher sites and so on as well. So it is the lower end version of the suite of CINAHL databases. So just a few facts about CINAHL itself. Over 6,500 journals are indexed in this database, of which 3,700 plus are actively indexed. That means they're the current journals, as it were. And you can see the range of specialties, or the number of specialties covered. For nursing, 115, for allied health, 112, so closely matched there. So it is a nursing allied health database. It complements like a Medline that you may be using elsewhere. We have the index for CINAHL, which is closely related to the mesh terms, the medical subheadings for Medline, provided by the National Library of Medicine. In fact, it is now updated quarterly as opposed to annually. So subheadings are assigned to articles based on the content coverage by indexers. So that's now updated quarterly, because as you can appreciate, new conditions, new treatments, procedures, terminology is used. So of course it needs to be current with present practice and so on. So new terms are added to that index in response to user feedback, the indexer themselves, their recommendations, and also the ongoing monitoring of professional organizations. So we'll say more about the indexing of content in CINAHL shortly. So it does cover these specialties among those others. So these are just a handful really of the kind of specialties you'd expect from within CINAHL. So literature relating to these areas, so cardiovascular nursing, critical care nursing, nuclear medicine, occupational therapy, physiotherapy, psychiatric nursing, and more. So as I mentioned, 115 specialties in total covered presently in CINAHL, with 112 also related to allied health disciplines. Access, and again, some of you who work directly in NHS Scotland for the Knowledge Network, etc., can correct me if I'm wrong, but I understand that access is primarily through the Knowledge Network portal. So you can see a link here to this, so knowledge.scot.nhs.uk. And from within this page, there are two ways to do this. One way, of course, is to go to Search Databases, the center button there, and click through to that. And then that will take you to this page with the list of databases, the subsequent list of available databases to you in Scotland, working within the NHS. and then you can locate the CINAHL database and follow the prompts to sign in there once you get to that page. So that will take you to the login page, and then you will go forward with access to the new EBSCOhost interface. So this is the default landing page. So you can see that here clearly. You may think, well, there's a lot of white space on this page, or that's an advanced search screen. And that's intentional because we do support ongoing efforts to increase accessibility to these resources, including assistive technologies, screen reader navigation, also for future enhancements as well, and to reduce the cognitive load for the user when using the platform. Okay, so again, this is a default landing page. So although it is the advanced search page, you can perform basic keyword searching on this page, as we'll see as well. So the first thing I want to introduce you to is the AI assisted search. So for some of you, you may have seen this before, and it is referred to as the natural language search mode. So natural language search has been now superseded by AI assisted search. The functionality is the same. The reason for the change in term and labeling is to make it more explicit to the end user, so for yourselves. Okay, so just to indicate that when you're using this feature, an alternative way of searching for evidence for content, you are actually generating a response from a large language model. So you're using AI. So essentially, it's a search feature that allows you to query the database, CINAHL in this case, using everyday language. So when you use this query, you use this search mode, it will prompt. So you enter your term or terms in the form of a statement or a question. It's not designed just to enter a keyword search, for example, like anorexia nervosa or heart disease. It is designed to respond to a question or a statement, and it's sent to a large language model, which will then create the query. You can see a screenshot there. So the top one shows you a question with the AI assisted search selected, and we'll see that live in due course. And then the requiring query is also displayed as well. So you can see clearly how it's interpreted your question into a query to generate responses. So obviously the results that you retrieve will be lower than if you did a simple keyword search. And that's, of course, intentional to make sure that you're finding relevant content. And just a note there that EBSCO's AI-assisted search mode, does not collect user or query data for training purposes, and it's only searching within CINAHL. It's not going out to other databases, other EBSCO's databases, like Medline, for example, and it's not going to the open web to provide that information. So it's purely sourcing content within CINAHL itself. So again, there's the option there to switch that on. So it is available. You need to switch that on, as it were, when you're using it. So there is a tutorial I've included here, a brief video displaying, detailing that as well. So you can watch that in your own time. That's in the slide deck, which you'll receive a copy of as well. And we do have some support materials to cover that. So the FAQs page will give you more information. So before I get to searching then, I want to do a brief demonstration of that. So I will switch screens here, and I'll switch over to my desktop, and you should now see the home page for CINAHL. As you can see here, if I click on CINAHL, by the way, it does show you other databases that are available. That includes Health Business Elite for the non-clinical information provided by EBSCO there, and also Medline as well, and others like Nursing and Allied Health Reference Source, which we don't cover today. So it does give you links to other resources from EBSCO. So we have the advanced search page, as you can see. A couple of things to note: there have been some changes in recent times to the navigation for this interface. So for those of you who have seen this before, we now have the new search option, browse by, and research tools displayed on the top of the screen, not on the left-hand panel as they were. So this was rolled out a few weeks ago, at the beginning of July, for all sectors worldwide. So browse by will give you access to the publications, CINAHL headings, and also EBSCO Connect, the main support portal. But we'll cover some of these other elements as we go and look at searching. But for now, I will go to the basic search screen. So click basic here, and to highlight the AI assisted search. Now it can be used on the advanced search page, which I'll show you in a moment. But you can see here, we've got the reference to AI assisted search. We've got this little note here. What is this? So it clearly explains to you what this is about and what it does. So essentially it gives you some example of kind of questions that you might want to ask. So for example, how does social media affect mental health in teens? Communication strategies in nursing. So in the form of a statement or a question, as opposed to just one or two keywords. And we do have more information on this via EBSCO Connect. So this is our support portal, the main source of documentation, tutorials, handouts, etc., promotional materials on various resources that EBSCO provides. And you can see detailed information, a link to the FAQs page, and also the screenshots there. Okay, so we'll go through this live now. Okay, so close that. So to use it, I just need to switch that on. So that will appear in this page, and then I will enter my question here. So what I'll do now is enter it. So what is the impact of AI in nursing practice in the UK? So this is my question, okay, using everyday language. And if I click search now, in a moment, you should see the query that's generated. So you'll see results below, as you would expect when you're running a search on CINAHL. And we've got 126 results. Okay, so quite a specific question, a good number of results, but obviously not too many. But another thing to consider then, when you're looking at this, you'll see in the result list, each of the terms used are highlighted in yellow in the title or bold in the abstract or in the subject fields. Now, you may see other terms there that I didn't use. For example, I didn't put artificial intelligence, I put AI, etc. And I put UK there, but you might find United Kingdom also indicated. But if you go to the show refined query option, if I click on that, this will show us explicitly how the model generated the query to bring back those specific results. So when I put in AI, it's also interpreted that to include artificial intelligence or machine learning or automated systems. So it's expanded it somewhat. I put in nursing practice, it's come up with nursing or clinical nursing or nurse. And I put in UK, but it's also understood that to be United Kingdom or Britain. Okay, so again, it's generated this Boolean query. We call it Boolean based on the combination of terms using or and I'll say more about that as we go through the session. So you can see clearly how it's searching, and then the results are detailed below. And you can see here, for these search results, by default, the abstract is displayed up front. So you can see where abstracts are available. You can obviously collapse that if you need to. And with the subject terms indicated below, you can see them also displayed as well. Or if there are more, you can click on show more and so on. So you can see clearly that the key terms, the key elements are highlighted in yellow for the title. And then you can see the other terms within the abstract and subject fields are in bold. Okay, and you can see various links below them. So if you want, you can filter further. So at the moment, we've got all results. But if you wanted, for example, to look at the last 5 years as opposed to, previously, obviously a lot of it will be very current because of the nature of AI. But if I go to all dates here and say, for example, I want to look at the past 5 years, then I can filter accordingly and generate results based on that. So these will be articles published in the last 5 years, and you can see we're down to 97. So the majority are recent publications, unsurprisingly, because of the nature of AI and its ongoing development and impact, in this case in nursing practice. And if we go to all filters here, you will see there's the option on the right-hand panel to select English language only as well. So if you want English language articles only, then you can apply this filter and we'll reduce that figure further. Okay, but it's like a starting point. It's pretty focused, and see these are all in English in any case. And any filters that you've applied, by the way, if I click to all filters again, you'll see them displayed on the top right. So these are the active filters applied to the search. And if you want to reverse it, then you can simply remove any of these by clicking the cross and applying it. Now, I mentioned that it's also available and you can use it through the advanced search page. You may not even go to this page. The advantage it has, it does show you the refined query. However, if you go to advanced search or click new search to go back to the advanced search screen, you'll see under search options, it's also displayed as a search mode, AI assisted search. So again, you would select that option and enter the query. So again, if I put in the same thing, AI on nursing practice, and if I just put nursing practice this time, not UK, then, and I need to untick this box, by the way, click search, then you would see results. Now I've removed the UK element, so we should end up with a lot more results than before, but these could be from the US. It's over 3,000 in fact. So again, and this one's a systematic review, as you can see there. So again, a lot more results there. And again, you can go through and provide filters. For example, you've got, again, the dates filter here and the source. So again, you can go for the past 5 years for this set and review those results as well. So again, obviously you construct the query based on what you need to know. you could add the geographic element. For example, UK, you could mention Scotland, for example, instead of the UK, so more specific, and find what's out there. Okay, so that's the AI assisted search. Again, there's more information in the slide deck on this. So also to let you know, under MyEBSCO, this will be the folder account, which I'll refer to a bit later. You've got recent activity. So at the moment, it's tracking what we've been doing. And you can see here, we've got a listing of the references included where we've applied filters, etc. as well. As you can see here, this one with English language. So again, it tracks what we're doing on this page, although you will also find there is a search history available from the advanced search screen whilst we're running other searches as well. So for now, I'm just going to remove these. I'll just select these and delete those from this session, as it were, and click new search to go back to the advanced search page, because we're going to focus on that a bit more. Before we do that, I will go back to my slide deck to introduce some of the concepts as well. So we've covered briefly the AI assisted search, which is available to you, and we've now looked at searching in general. Now, for searching in general, we can approach this in one or two ways, or both ways, inevitably, ultimately. The first, which of course is what I mentioned at the outset, is the use of keywords or free text terms, where you're searching for the literal occurrence of the word. So if you enter the phrase bowel cancer, you'll find records with bowel and cancer are mentioned somewhere within the fields, within the citation, etc. Okay, so obviously if you mistype that, then that will also impact your results. Subject headings, as I mentioned, are used to retrieve records based on the assignment of index terms. So the headings are provided by the National Library of Medicine, closely related to the medical subject headings used for the Medline database. And these headings are then assigned to articles when an indexer identifies that article is about this topic. So for example, while I use bowel cancer in the initial example for a keyword search, colorectal neoplasms is a index term. So it's like an official term to identify articles about bowel cancer, for example, and that would be assigned. So the screenshot below just gives you the entry, the initial part of the entry detailing the term. There's a scope note detailing what this is about. There's an option to select it. So in other words, when you select that box, you tick that box, it will achieve any record in CINAHL indexed with colorectal neoplasms in that instance. Okay, so and you may wonder, why would you use both? Why would you use one or the other? Keyword search terms are great because it means that you'll find obviously an exact match on the terms you enter. It also means you may find more recent additions to the CINAHL database. We call them pre-CINAHL, because not every item in CINAHL has been indexed, where article subject headings are added. So you'll find sometimes entries in the result list where you see the site title, you see the abstract, but no subject fields. And that's a pre-CINAHL record, has not been fully indexed. So indexers have yet to assign headings to the article. So using keywords means that you'll find references that are still relevant. However, use of the subject fields is more authoritative because you're guaranteed to retrieve records that are relevant because an indexer has identified the content coverage of that article and assigned the relevant heading. So typically you'll be using both options to find what's out there. Now, obviously, you can go very much more in depth, as we'll do in the advanced session, but we'll keep this quite simple. But again, the principles here we'll cover in this session. So for a keyword search, we refer to it often as an unqualified search, which means that you are searching the database, in this example, nurse prescribing, according to all fields. So there is another caveat to keyword searching. Within CINAHL, any keyword search, any free text search, is defaulting to these fields, all fields, which include the title, the abstract, the subject heading itself, that's word index based on the word appearing in those terms, the PubMed ID, which also is a different thing, digital identifier, and then the author field. So if your terms, so if you put in nurse prescribing or bowel cancer, if those terms appear somewhere in any of those fields, then results will be retrieved. Okay, it doesn't have to be appearing in all of them, it can maybe only appear in one of them. And of course, for PubMed ID, DOI wouldn't be relevant because they're based on codes, etc. So we have more information on what is an unqualified search and also which fields can be searched using the all fields drop-down list. So we'll vary between databases. So for CINAHL, you can see what it would be. For Medline, it's something different. Okay, but the bottom line is you are searching without focusing on a particular field code like title or abstract initially. Okay. Now, in terms of the search modes, we just saw that live in the demonstration when I was looking at AI-assisted search. You can see AI-assisted search is a search mode on the screenshot. So these are, of course, located within the search options tab on the advanced search page. And the default option, and I may need to correct this, but let me just double check here. Yep, it is. So the default option for yourselves in Scotland is proximity. As far as I know, it's still the default search mode. I need to check that. But that means it will search for words. So again, using the example, nurse prescribing, nurse near 5 words or less of prescribing, or prescribing near 5 words or less of nurse. Now that can be adjusted in our admin tool. So if you're a library administrator responsible for overseeing the databases, and this would have been done centrally for Scotland through the Knowledge Network, etc., then it may have been adjusted somewhat differently. So again, perhaps some who work for NHS Scotland could actually comment on that specifically if you're library administrators and aware of that. But we do have more information on the search modes. You can see within the screenshot, and you may have noticed it in the desktop when I just demonstrated it, there is an EBSCO Connect link that takes you directly to the page describing, detailing what is a search mode, what does it do, etc. So proximity is really for phrase searching. So words could be in any order. Find all means it will combine the terms using and. So if you put in bowel cancer, it'll be bowel and cancer. Not necessarily as a phrase, but both terms must appear somewhere within the record. Find any relates to the or operator. So in other words, it's or. So you could put, for example, child or pediatrics, children or pediatrics, children, pediatrics, etc. So be or. Okay. I won't go to smart text searching. It's just another way of searching. But again, each of those search modes is detailed in the EBSCO Connect page. Okay, so another feature, and I noticed this has been enabled by default for yourselves, and that's why I want to mention it today in this session, is the use of suggest subject terms. So we just talked about keyword searching and the difference between a keyword search and a subject search. Now, with suggest subject terms, it means that you can enter your term, and I've got heart attack here, and when suggest subject terms is selected, and it is by default, you'll be directed by this button when you click it, suggest terms, to the actual appropriate index term. So it can be used in two ways. First of all, it's a way to run the subject search initially before you do a keyword search. And secondly, it allows you to identify what is the subject term related to your topic. So you can see in this example, heart attack is a keyword search. The actual index term used about, for articles about heart attack or reference your book chapters, dissertations, is myocardial infarction. So that's the official index term to identify references about heart attack. Okay, so when you select myocardial infarction, you add it to your search, it will retrieve articles indexed with that subheading. So you can be guaranteed, therefore, that unless they're new items not indexed, they would be relevant to your search. Okay, so it's a feature designed to map you, direct you to the subject term, select, and then you can retrieve records that are more authoritative and more relevant because indexers have identified the content coverage. So again, this has been enabled. And as I said, once you select the index term, the subject term, you can add to search and then run that search to retrieve results based on that index term, that subject term. So I'm using index term, subject term interchangeably there. And there is more information about how to use that feature as well. So if you're going to want to clarify this post session at some point, it is available in the slide deck. So it brings you on to the use of operators known as Boolean operators and the way in which you combine your searches. So I already mentioned in the AI assisted search, a Boolean query, a refined query is displayed, and that combines terms using and, or, etc. So and will combine two or more search elements. So the effect of that is that it narrows your search results. So if you had leg ulcers, it will be leg and ulcers. So in other words, it only retrieves references that include both terms. So you have fewer, more specific results. Or on the other hand, connect synonyms or related terms. So if you're doing a search for older people, you used aged or elderly, it finds references, either of those terms being used. So it retrieves references with either term. Again, you generate more results this time. And this is very useful for catching variations. Again, you can use children, pediatrics, for example. Not is another alternative, and that excludes a term from the search. So it narrows search results by removing irrelevant topics. So if you want to focus on Scotland specifically and not England, or it could be not Wales, for example, then you can use the not operator in that way. So retrieve references about topic A, Scotland, but excludes those that mention B, England, in this example. So it's more targeted. Okay, so again, and we'll bring back specific results or more results, especially obviously related to like terms, and then the not option is more targeted. So we'll look at the and or particularly today as we run through a live demonstration. I know at least one person wants to see a search from scratch, and we'll go through that in a moment. So we'll go back to the live desktop and we'll run a search now. And I mentioned heart attack, so we are going to look at that as a theme, as it were. And to begin with, I will run the initial search. So when I put in heart attacks, again, we saw that in the slide deck in the presentation, by terms here. Now you'll see this autocomplete feature. Basically, these are terms commonly used by users globally, not just within Scotland or the UK or Europe. So it's outside of that. You don't have to use those terms. It can be quite informative, but generally speaking, you may want to just carry on, enter your own terms. Obviously, the more you know the topic, the subject area, as clinical staff, as healthcare staff, as nursing staff, allied health professionals, you'll be very familiar with your topic, and so you can enter the terms that are most appropriate. So I'm just going to put in this phrase, heart attack. I am not going to qualify it, so you can see the drop-down menu gives you different options, like title, for example, or title and abstract. I am not going to qualify this. I'm going to keep it as an unqualified search, which means we'll search within the default fields, which I mentioned in the PowerPoint. But to begin with, before I actually even do that, what I'm actually doing, because this is now on suggested terms, I have this selected, and you'll see it says suggest terms. Now to note, there's a little information button here, which gives you a review of what this is doing. So when it refers to the subject terms authority file, it's referring to the CINAHL headings. In other words, what's used by indexers to identify the content of the available articles within CINAHL, etc. So if I run this search now, if I click suggest terms, you'll see immediately it'll take me to the index. And as we saw in the slide deck, it tells me for heart attack, we should be using this CINAHL heading. If I click on that heading, it will give me the scope note. So it tells you what myocardial infarction is. It tells you what it's used for. So it's used for heart attacks, infarction, etc. Okay, all those terms. So if you run a keyword search on any of these, this is the actual equivalent index term. Okay, so articles assigned to this heading mean that they are about heart attacks, etc. So if I select that and I scroll down, you'll see the hierarchy of terms. So the subject terms within CINAHL, like other databases, are arranged in the form of hierarchy. So at the top of the hierarchy, the tree view, if you like, are diseases, in this instance, cardiovascular diseases, heart diseases, myocardial ischemia, and then coronary heart disease, and then we've got myocardial infarction here. And below that, we've got anterior wall myocardial infarction, inferior wall, etc. Now, as well as selecting the term, the main term, so in those we retrieve articles about myocardial infarction, so where this has been assigned to those items, we can also select major concept, which means that we're retrieving articles where that is the primary disease or condition mentioned in that reference or that article. Now, generally speaking, because we're going to combine our terms later, we may not focus that quickly, but major concept means it's the primary subject matter of any item assigned that subject heading. If I tick that for now, there's also the explode option. So by default, in this example, in this demonstration, when I explode the term, it will also include articles indexed with these other terms below as well. Okay, so it's expanding or exploding the search to broaden it, to bring back more results. There is also another feature that you can use. I don't want to get too much detail here. We are reviewing this also. This use of subheadings, and you can be even more focused. For example, if you want to look at complications, for example, and there's a little note here about what that is. Etiology, again, some of these are available. You can select all or individual ones. Now, not every article indexed with myocardial infarction has a subheading assigned to it. So there will be differences in numbers if you stick to the way that I'm doing it, explode the term as I am, or decide to go select all subheadings. So again, there's a difference between the two. Okay, so but at this stage, we're going to keep it quite broad. We may see more about that in the next session. And so I am now going to jump to the top of the screen. And with that selected, I'm going to click add to search. and you can see we've got this string here. So this indicates MH, it's the exact CINAHL heading. So it's the definitive subject term for articles about heart attack, etc. With a plus sign indicates that we're not only searching for myocardial infarction references, but also those related to other narrow terms listed as well. And then we click search. So this is the subject search. Okay, this is where items have been indexed as side headings, and it will retrieve those records. And you'll see below the search boxes, we have the search history. Okay, so you can see that this is S1 or Set1. The search option proximity is on already. We've got the number of results here, and this icon here gives you the database we're using. Obviously, if you're using Helpers Elite, it would show, or Medline, etc. The save ribbon there allows you to save this search set. If you want to save it, it will be saved into the MyEBSCO save folder up here. Okay, and then there's also the tools menu, which allows you to edit search details, add it to a project, and a project is a custom folder, which we'll say more about before we end, and then delete if you want to clear the screen or just remove that. Okay, so that's the first element of our search. We're going to look at the equivalent keyword search terms. So this is where I'm going to put in heart attack, okay, for now. And I'm just going to run it on this, in this area, heart attack, and click search here. And now it's going to retrieve records where those terms are mentioned somewhere within the fields I shared earlier. Okay. So now we've got the two terms. One is the subject search. One is the keyword or free tick search that we're using. And then we can select both sets and use the OR operator, because heart attack, myocardial infarction are essentially the same topic, but one relates to the keyword search we're doing, and the other is the subject search. So if I click combine with OR, you'll see that is posted in the top search box. So set 2 or set 1. So either retrieving records where heart attack is mentioned, or we're retrieving records which have been indexed with that subheading. Okay, and then so that number should increase. So each time I click search here, it's going to post that search string in the search history. And you can see we're now onto our third set, S3, and you see these combined and you see the total figure. So you can see one of the reasons why you would do a keyword search alongside a subject search. Obviously, you end up with more results with a keyword search, but at the same time, when you combine that with the subject search, we end up with a few more, a couple more thousand records. Okay, so it's useful to do because it may be that heart attack is not mentioned in every record. Other equivalent terms are. So again, it shows you the usefulness of performing both a subject search and a keyword search. Now we're going to look at statins as an intervention. So I'm going to follow a similar procedure. So I'm going to put in statins here. Again, you'll see a choice of terms that you could use based on other users. And then select suggested terms, click suggest terms, and then we're directed to the CINAHL heading, which of course in this case is actually statins as well. So if I click on that term, this is the main term. I won't try pronouncing this, so you can probably. I'll click select statins here. Again, you can see other things to note here. History notes. So before 1999, anything related to statins would have been referred to as this. Okay, so again, statins is a more recent phenomenon. If you like, almost 30 years ago. It wasn't around, it wasn't indicated, as it were, in that way. And then again, you see the tree view. So these come under enzymes, etc. If we scroll down, you'll see the reference to statins here. Okay, and again, with the option to explode, it would also include the various ones here. Okay, so if I jump back to the top of the screen, and also there may be something else I want to include here. So chemicals and drugs, also lipids, and these ones. So I'm going to select those as well. Jump to the top of the screen, so I can combine two subject searches. So you can do that from this list. And you can see the syntax again, MH, indicating that these are exact headings. That is also, by the way, rendered in the drop-down menu for the search boxes here. So you can see exact subject heading, which means it's the definitive term heading used by indexers when referring to articles about this topic, these subject areas. And I can run the search for these two to retrieve results, and then I will then go in and look for the equivalent keyword search. So we've got S4 now, and then I can just put in statins here. Okay, for now. Okay, and then click search here. Again, if I was doing a more advanced search, then there are other things I can do to enhance the likelihood of finding information, consider other terms, but we're going to keep it at a basic level in terms of the theme of this session. So I will then look at combining S4 and S5. Okay, so the index, the subject term with the keyword search term, again with or because they're related, and click search here. Okay. So once I've done that, I'll also show you that you can resort the search history. So at the moment, you can see it's S6, S5, S4, the set numbers. So we're looking at this in a reverse chronological order. So if you want to see the sequence, then click the ID option above, and you can see where we started from, and we're in this order now. So that means I will then look at combining S3, S6. So we want statins in relation to heart attack, essentially, for a search, and then use the AND option this time. So we can combine the search strings, and you can see S3 and S6 is detailed above, and then click search. So now I'm combining the two sets of results, those that are about heart attack, myocardial infarction, those about statins, etc., into one group of records. So you can see here, we've got set 7. There's over 5,000 records here, and they're displayed in the results below. Obviously, there's a lot to look through. Depending on the nature of your query, you may want to save that amount or export that amount of records. But in this instance, in this session, we're going to reduce it further. So to do that, we can apply filters to the search. So we've got the initial filters here, for example, all dates here, source type. But I'm going to use it from the all filters page. If you click that button, they come on the right hand side, they appear there, and you can see we've got the English language here. So we go to English language only. Publication date, so I'm going to go for the past 5 years. So these are publications in English published since 2021. And you can see source types, so academic journals, if you want to go to academic journals only, etc. So again, we can choose those filters, etc., and we can apply them. Now, when we apply filters, it's going to refine your search results, but it's also going to record that in the search history as well. So when this appears, you'll see S8 now. So we've reduced the volume of results from 5,000 to 667. And you can see the two filters we've applied, English language 5 years, have appeared in the search history. Okay, we're still currently on CINAHL, as you can see there. So we've got the results below. As we saw with the AI-assisted search, the results do give you the abstract up front. So that's a setting that is managed. So it may be displayed without that, but it's been agreed at a national level to display the abstract. So you can see that up front. You can go through results and check those that are particularly relevant to yourself, okay, or that you feel you need to save. So once you've got the records, obviously you can view the details. You can check the abstract. You can check the subject headings. You can see they're listed here. So statins was one that we selected. Myocardial infarction, likewise, others here as well. And then if you want to view more detailed information, then you can go into the record itself and view the detailed record page. So you can see the citation, the article, the journals published in, the database, of course, the authors, and you can see, you can click through to these authors as well to see other articles by the same authors. There's a link to the NHS Scotland full text that's also available on the result list page. So it gives you the details, as you can see there, the affiliation of these authors, etc. You can click through to the journal to view other articles in the same publication, and you have the various subjects also listed there as well. And if you go back, you'll see the digital object identifier also given there as well. And then above that, you'll see a list of references also given on this page. There's a tab there detailing the references. You can also sort the references, by the way, the most recent, etc., or by citation count. You can check those, check which ones are full text, which ones are actually already in CINAHL, and also you can save them. So you can set the save ribbon to save any of the references here as well. And you have other tools here which are referred to when we look at the result list. Publication contents is also given, not in this instance, unfortunately. More like this is a recommendations feature. It doesn't always apply as in this case. But what I'll do here is go to results again. So Carol's asked, are we still able to filter by publication type? Yes, I believe so. If I go to new search here, and you will see the list of filters here. So for example, we've got research article there. Let's see further on down here, you might see publication type here as well. So for example, as you see here, case study, clinical trial, etc. And if we go further, you'll see there's also meta-analysis, nursing practice guidelines, systematic review as well. So they're also included there. So there are additional filters on this page that you can also use as well. So they're available. If I go back to the search, having looked at the references, or the initial reference as it were, on here, as I mentioned, you've also got the option to explore the full text. Now I'm going through an EBSCO system, as it were, rather than directly through Knowledge Network, so I might not access everything here, but it looks like I will do. So I've got the LibKey link resolver, so I think that is the NHS Scotland full text there. This takes you to this option to download the PDF or link to the article from here or view it in context. Okay, so this has been set for NHS Scotland, as it were. So that's the link resolver, which means you're linking to the publisher content externally, if you like, as opposed to going directly into a link available within CINAHL. As I mentioned, there are active full text journals in CINAHL, but only a very small quantity, about 30 or so, so not that many compared to other versions of CINAHL. But you have other means, as shown here, to link to the full text. So again, you'll see NHS Scotland full text here as well. And also to note on these records, you'll see a reference to the cited by count. So if I click on this link here, it will give you the listing of articles that are citing this article. And obviously, the higher the number, the more likely this article is to be relevant to what you're looking for. Again, within this list of articles that are citing this one, you can check which ones are full text, which ones are in CINAHL directly, and you can sort them by the most recent as well. And also with the save ribbon, you can also save these to your folder, and I'll show you where you can find those in a moment. So again, more like this. I'm going to see if this one will give us a list of references. Yes, this one does. So typically you'll find up to 5 records that are recommended based on your search. So again, you may want to look at this, look at the details, view the full text, check the abstract to see, is this something which is of interest? And just to note, there's also this recommendation of what this is, how this is retrieved, as it were. And you can just scroll through to the next one. So more like this is really a means of recommending other articles that you may have missed in the original search that could be useful. Again, cited by count, you can see this one has 11 citations if you like as well. Okay, so they're available there. Now I'm just going to hide the search history, by the way, so I'm just going to collapse that. It's hidden in the background now, and I'm just going to go into one more link, one more filter here, just to show some other options for full text. If I click link full text here, then we are going to reduce this considerably only to 4 references. As I mentioned, with this basic version of CINAHL, there's only a limited quantity of full text available. So we have these 4 articles based on a search, and you'll see here, this one has PDF. So if I click on that button there, that link there to access PDF, it will give you the PDF article available through the EBSCOhost database. So this is CINAHL, of course. So it's the original look and feel of the publication available electronically. And you'll see here we've got these icons across the top of the screen. You can save this item. Okay, you can also generate the citation for this. So if you want to copy the citation of this article in Harvard referencing or alternative formats, you can do so from here. You copy that to the clipboard, and you can also export the citation into RefWorks, EndNote, and so on. I'll probably say more about exporting in the next session. There's also this little icon here, this folder icon, add to project icon. Projects are a custom folder that you can use to, save searches, save references in one area, as it were. So again, I'll come back to that in a moment. The share tool is also available here. So if you want to, save this to Google Drive, OneDrive, or just simply create a link to this document, then you can do so and copy that to the clipboard. There's also the email feature. So if you're using this, want to share this with a colleague, or if you're in the library team and you want to share it with the user, then you can just add your email address here and then choose the appropriate, and I'll just do that now, put my email address there, and choose the preferred display. So brief citation by default, you can include the abstract. If preferred, you can select fields that should be shown. So go to detailed citation, and then you can still include the abstract. You can remove others like accession number, for example. You can include the PubMed ID and so on. So again, you can customize the sharing of information through the detailed citation option when you're emailing a list of references, or in this case, just one article, but that's also applicable to other result lists as well, which we'll see. And there's also the download option if you want to download the PDF article to read it offline, or simply want to download the bibliographic information in a choice of formats, including Word as well. So those options are available. There is also the publication content, so you can explore other articles in the same journal. It could be a themed journal, for example, so other articles may be of interest. You can just click through to them. And we do also have the text-to-speech software to enhance accessibility. So rather than printing this or downloading it and reading it offline, you can listen to it being read online in the background, as it were. Or if you want to listen to it later offline, you can download the MP3 here. There is another little icon here. This is the accessibility support icon. So essentially then, if as a user you find, sorry, let me just cancel that, problems using or reading PDF articles online, then you can submit a request for an alternative format, for example, Word or HTML. So again, you have the choice of formats there. You can submit your preferred name, email address, and it will typically take 3 to 5 business days to process this. So it won't be as immediate as you see the PDF now, but you will receive the alternative format, which may be a preferred format for yourself or for your colleagues, etc. So that's the accessibility support option that you'll see appended to the full text content. So that is the PDF content. Now, there is also in this result list online full text. If I scroll down, and sometimes you'll have both options available. So for example, this one's online full text. This one has both PDF and online. Okay, so if I go to the online full text for this article, you'll see the full text article there. And a couple of things to note that are different. You have the content navigation. So again, you can navigate more easily within this article. So if you want to look at management, in this case, or diagnosis, you can jump to that section. If you want to look at the references, you can go there, or you can go back to what's the problem, etc., and so on. So you can navigate quite easily there. So you can still save this item. The site tool is also there as well. Again, same tool, add to project is there. Sharing also is available here. And the download option, of course, means you can download the HTML version of this article as opposed to the PDF in the previous one. And there's also the translation icon. Okay, so if you have another article, now I limited it to English only, then of course, if you're a non-native English speaker, English is not your first language, you can switch languages here. So for example, I can put this into, let's go for Polish, for example. I can switch that to Polish. Okay. So again, it's worth exploring. It is a machine translation. So in a moment, you will see that disclaimer, if you like, at the top of the screen when that's completed. So it's produced by an automatic translation program, and that's provided by Microsoft, as you can see clearly on the right-hand column, translated by Microsoft. Okay, so again, if you're a native Polish speaker, then you'll know how accurate or otherwise that is, or whichever language you choose, but you can revert to the original language as well. Now, to note, a note for translation, so that works within the HTML only within EBSCO's databases, so within CINAHL in this case. And when you select the text-to-speech software, it will only work with English language. Okay, so again, even if you translate the article, it will not play the text-to-speech, basically. So you can still download the MP3, of course, in English, and you can change the text highlighting as well when this is being read online. So again, those options are there. So you have still the text-to-speech software with the additional features of word highlighting, sentence highlighting, and then you have the translation option here as well. And then the other options are still present. And publication content's also listed there as well. Okay, so we can go to other articles as well. So just another question there. Okay, yes, Carol mentioned the filter as well, so I'm going to come back to that in a moment. But, well, time is moving on very, very quickly. So I want to make sure I cover some of the other elements as well. So let me bear with me a minute. I'm just going to check something here and make sure that we do that. So I'll come back to that in a moment, if you don't mind. So we've looked at the full text just now, the initial references, the detailed record. Now, of course, if you're looking to save these records, there are a number of ways to do that. You'll see each record has the save ribbon next to it, so you can save individual records. You have the tools available for individual records as well, including the Cite tool, Add to Project, Share, or Download. But when you look at a list of records, I've only got 4 here. You can select these and choose, the number. Now, at the moment, what it's showing is 1 to 50. If I sign in here as a user, so one of the key things here, if you are going to save records beyond the session and eventually save searches, you need to be signed in as a MyEBSCO user. So click the button there at the top. You'll see the option to create an account. So if you have EBSCO single sign-on in Scotland, then you wouldn't necessarily need to go through this. Perhaps I need some clarification on that. Otherwise, you would need to enter your first name. Last name is optional. Email address. You create the password, note the criteria below, so make sure it meets that criteria. And then you agree to the consent form for the collection of specific data. And if you're concerned about that, there's the privacy policy you can access here. And then you create the account. Once you create the account, you can sign in, as I'll do now. So now I'm signed in. And if you look on the top right, it now says Richard as opposed to MyEBSCO. So this means I can use the projects, I can get save records beyond the session, etc. And if I now go in to the save option, there's a new feature, the ability to select up to 500 records now. So though the view is still 50 per page, you can actually select obviously less than that. I've only got 4 here, but up to 500 here. So if I were to go back to the original list of results in my search history, so which I'll do now. So I'm going to delete this set. This one, I'll delete this set here. I'll delete that one. So you can delete that by the icon there. Just remove that set. Go back to the original set results I had, which is 667. It now means I can essentially send quite, much more easily. So I can select this list, it'll select these, sorry, and then go to save. And then it will give me the option to save up to 500 with one click. Okay, obviously I'll need to save a further 167, but it's a lot simpler now. Rather than 50 at a time, it's a 10-fold increase. So I can save that initial 500 to my save folder. Much Ruth. And Christie's just mentioned there, actually, thanks for that. MyEBSCO accounts will move to single sign-on, allowing users to sign in with their NHS Scotland work email address. Okay. Okay, and I know some had to leave because of the time, etc. So those are saved, and if we go to the top right of my screen, they're now saved in this folder. Okay. So you can see what these are. And I had 3 that I saved also during the session. So then now they're listed here. You can still access the full text there, and you can sort between the oldest and newest there as well. Okay, so that's the save folder. They're now stored there for reference. Alternatively, I can save them to a project folder. So what I can do here, I can download actually. If I go in, I can also download up to 500. Just click the download option. I won't open this up because of time, but you have a choice of PDF, MS Word, CSV, so for a spreadsheet or BibTeX there. Those options are available, and you can download up to 500 in one click if you select the 500 option. Add to folder. So if I go to select 500 here, go to add to project here, this is where I can set my own personal folder. So I can choose one that I've created previously, or if it's completely a new topic, go into new project, and then I can create this project folder. And and statins. Okay, and I can give it a due date if I'm working on an assignment or project or paper. I can give it a deadline for that research to be completed, and then create that. And then I get the option, and then you can see here, I can now choose this project and add to 500 records to the project straight away. Okay, so again, you may want to bypass the save folder altogether. So the other tools are in the same way. If you want to share, you can share up to 500 now from when you have that many results. So I can just select the number, Google Drive, OneDrive, or email. Again, it works in the same way. And then also you can generate a list of cited references up to 500 here as well, including exporting into RIS format. So if you want to do a direct export into RIS format, for those who are familiar with it, you can do that from this page. Okay. So just to clarify then, I know some have to leave the session, so apologies that we've gone over a bit, but just for the sake of clarification with saving searches, if you want to save a search, then there are a couple of ways to do that. The one way I'll show here is, first of all, you can just go to your search history here, select the sets. You have the option to download it here with a choice of formats, PDF, Word, etc., or CSV if you want a table which you can edit in Excel. Those options are available. You can click the save ribbon to save it into your save folder, or you can go to the project folder. So since I want to merge this, if you like, with those saved records, I can choose the same folder, click add now, and then go to the top of the screen and then go into my projects folder. So this is the project I created here. If I click on that link, it gives the records that I've saved. So those 500 records are now stored here for future reference, for screening, etc. But I've also got my search stored here now as well. Okay, so you can see the search is laid out here. Now, there's other ways to do this, and we'll cover that in the second session when we look at saving search sets. So again, that's just the initial elements I wanted to focus on today, because there's quite a lot to cover, and I appreciate we're kind of out of time, as it were. But going back to Carol's question regarding the filters, if you can edit searches, by the way. So for example, in this instance, if I go to S8, if I go to the tools menu, click edit search details, I go to edit search, and on this page, you'll see we've got filters here. So I can go to the filters and apply a filter, for example, research article here, etc., or publication type. I can go in here. So for example, randomized control trial. I don't know how many we'll find, but you can select the option and click search. And let me see if this will work here. No, unfortunately, it doesn't work yet at the moment. I need to review that. But the initial search filters are available on this page. There are obviously other search filters as well available on the all filters page as well. So I'm just going to cancel that for now. And that one. So all filters does give you other filters here as well, publication date and so on. Okay, so I think we need to follow that one up with you as well, because there may be just an issue currently with doing it retrospectively, as it were. Okay, so just to clarify then, in terms of support for the using interface, and it's new to you, we have got research tools. So EBSCO Connect is the main support page, and it takes you to the quick start guide for EBSCOhost. So for using CINAHL EBSCOhost, and you can see we've got the various references to applying filters there, searching there with operators, using the dashboard. So this is where you've got the projects folder, the save folder. Again, these have been updated to reflect the new navigation as well. So again, there's plenty of support materials available within this page. Okay, and so using the bookmark feature and so on, again, with screenshots provided as well. So I'm going to stop sharing here, just go back to my PowerPoint. So I had the live demonstration there. Just to take home point before I clarify the support materials, obviously you can leverage AI-assisted search to help identify relevant concepts and retrieve high-quality results more efficiently. So that's using the large language model that's been prompted based on using everyday language in the form of a question or statement, so it's very focused. Use keyword and subject searches to locate relevant literature and access full text articles. You see how you can use a combination of those as well. And also refine your results with filters such as publication date, peer-reviewed journals, age group, and so on. We didn't use age group specifically, but that's also available. And then view and access full text records by navigating abstracts, full text, and event library holdings. And then you can create and use a MyEBSCO account to set projects, save articles, store and retrieve searches for future access. So again, some of this will be enhanced upon in the advanced session. In terms of training support, before I go to those questions, I have put in some key documentation here, the quick start guide, the FAQs, and reference to filters. There's more that we can provide as well. And we do have a dedicated training resources portal, especially for those in the NHS and related to healthcare databases. So on this portal, you'll see we've got the sections there on the training videos. So the recordings that we make are hosted there typically. So there are those that are publicly available you can access, and also a list of upcoming training sessions. So aside from these, which are intended specifically for yourselves in Scotland, we do have other sessions that we run for all sectors, as it were, or all areas of the NHS in the UK and so on. And then the support information would include additional handouts, tutorials as well, so links there. So again, you may want to refer to this site as well as EBSCO Connect, which is still the main support portal for EBSCO resources, so connect.ebsco.com, and there you'll find the initial tutorials covering EBSCO, the platform for which CINAHL is on. Obviously, you've only had this a few weeks, as it were. A lot of changes took place in the past few months, a lot of enhancements, and there will be more. So again, we'll inform you of those as well. But so we've got an advanced session next week and another basic one coming up. So again, this is the first of the 4. So unless there are any more questions or comments, I'm happy to stop here. Thank you.